Hi, good morning, Indy.
Good morning, Ness.
My name is Simone, and we're going to do a top-to-toe assessment today.
Okay.
I'm close the curtain to maintain privacy. Do you need a chaperone?
No, I'm fine, thank you.
Fantastic. I'll already check your observation. I check your temperature, heart rate, blood pressure, lying and standing, left and right arm. I check your saturation, respiratory rate. I check your height, weight, waist circumference, and blood sugar. These are all normal, so you can carry on.
Thank you.
These assessments will include some palpation or some movements, so let me know if you experience any pain or uncomfortable.
Will do.
Okay, so we're going to start with HENT, which is head, eyes, ears, nose, and throat. Have a look and inspecting your face and your hair. I cannot see any obvious asymmetry or drooping. I cannot see any lesion, rashes, or erythema on your face. Your head is normocephalic. You have a good distribution of hair.
Yeah.
So I'm going to have a look if there is any signs of alopecia or baldness. I'll have a specific look now on your head. I'm going to palpate your scalp. Is this okay?
That's fine, Ness.
Fantastic. So I have a look on your hair. I can appreciate the texture. There are no coarse or fine, which could be signs of hyper or hypothyroidism. I cannot see any psoriasis. I'm palpating to feel any bulginess or is there any tenderness, Indy?
No, no tenderness.
This could be signs of lesion or head injury. So these are all normal.
Yeah.
I'm going to focus now on the face, and I'm going to do some palpation of your face. Can you tell me if you experience any tenderness? These are your supraorbital ridges.
That's fine.
The nasal bridge, the zygomas, and the TMJ. Can you open and close your mouth? And I cannot feel any crepitus, which would be signs of rheumatoid arthritis. Any pain
No.
on the jaw? So all looks good. So I'm going to carry on doing now some cranial nerve assessment to assess your trigeminal. I would like you to show you on your hand.
Yeah.
This is feel sharp.
Yeah.
Yeah? And this feels soft.
Yeah.
Okay? If you close your eyes, can you tell me if you feel sharp or soft?
Soft. Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Soft.
Okay, so looks everything normal. Your three trigeminal pathway are intact. So I want to assess now the motor component of the trigeminal nerve. I would like you to show me your top teeth like this, and then your bottom teeth. Can you move your jaw side to side like a camel?
Yeah.
Fantastic. Can you open and close your mouth? And now can you open against my hand? It's a good strength, 5 out of 5, and your range of movements of the jaw is intact. Was any tenderness in doing these movements? No. So your cranial nerve number 5 is intact. I'm going to now assess your cranial nerve number 7.
Okay.
I would like you to have a sip of this and tell me if it's sweet or sour.
That's sweet.
Fantastic. So you can recognize sweet, which is the sensory component of the cranial nerve number 7, the facial.
Yeah.
I'm going to assess now the movements of your face. Can you smile? Can you close your eyes tightly, strongly? Can you now frown? Frown?
Oh, you want me to frown?
Frown? Can you show me your top teeth? Fantastic. And can you puff out your cheeks? Fantastic. So I can see any asymmetry, which could be signs of stroke, and everything, or Bell palsy. So everything looks normal. I'm going to carry on now assessing your eyes.
Okay.
I can see that your eyes are symmetrical. There is no obvious discharge from the tear duct. The eyelashes are intact. There is a good distribution of eyebrows. Your sclera is white. If it was yellow, it could be a signs of jaundice or liver disease. You have a brown iris and looks normal and equal size pupil. And the tear duct is pink. Can I ask you to do this for me? You can see the conjunctiva is pink. Can you do also the other eye? If it was pale, it could be signs of anemia. Fantastic. I can see also any xanthelasma around your eye, which could be signs of high cholesterol. Around the iris, I can see an arcus senilis, which could be signs of high cholesterol.
Okay.
Fantastic. So I'm going to do some tests now.
Brilliant.
First of all, I'm going to shine the light. Don't look at the light straight. Just keep looking at me or a point in front of you. Okay?
I think I look straight, yeah.
Fantastic. Okay? So for the optic nerve, cranial number 2, I can see there is equal pupil, equal and reactive to left and right, about 3 plus. I'm going to check now consensual response. And I can see the consensual response is intact. Indy, do you wear glasses?
No.
No. Do you have a good eye or a bad eye?
Yeah, I've good eyes. I've had laser.
Fantastic. So can you cover one eye cupping your hand like this? With the other hand, at arm length, hold it at distance.
Yeah.
And can you read from top to bottom?
Yes, I can read it. The top line is 9-5, then it's 8-7-4, then it's 2-8-4-3, and the next line is 6-3-8-EW-3-X.
Keep going on the numbers.
Okay, so then it's 8-7-4-5, the next one is 6-3-9-2-5, then it's 4-2-8-3-6-5, then it's 3-7-5-2-5-0, then it's 9-3-7-0-2-5, then it's 4-2-8-7-3-9, I think.
Fantastic. That's correct. So you have a 20/20 vision. If I was worried, I would check as well the other eye.
Okay.
But I'm happy with the test so far.
Thank you.
This confirms your optic nerve is working. I'm going now to check other parts and components of your eyes. I'm going to stand in front of you. I would like to follow the finger. Okay? Keep following the finger. Fantastic. So there was good accommodation at the end, and I could see that cranial number 3, the oculomotor, number 4, the chlorhea, and number 6, the abducens were intact. Couldn't see any flickering of the eye or nystagmus. Did you experience any double vision?
No.
So there was no diplopia. Fantastic. Indy, for the next test, I'm going to ask you to stand up.
Okay.
I'm going to check your visual fields. Okay? So I would like you to raise your hands like this, and then keep fixating on my nose. Don't look at the hands, but if you see a hand flickering, you do as you do. Good. Fantastic. So your visual fields is intact. You can come back to your seat.
Thank you.
I'm going now to assess the back of your eye. Ideally, I would like to use dilating drops, and I would like to dim the lights of the room. For the purpose of this video, I'm going to show you with the lights on. I'm going to assess your left eye, okay? I'm going to come quite close to you. I don't want you to look at the light. Keep fixating on the point in front of you. And if you experience any, be uncomfortable, just let me know, okay? I can see the red light reflex on both your pupil. So I'm going to get closer. And I can see your fundi. Fantastic, okay? So what I could see was that the back of your eye was a red color. There was a bright yellow optic disc with a cap about 1/3 of its size. I could see vessel coming out of it, 4 group of veins and arteries with no signs of any hemorrhages, and there was the macula being intact. I could not see any cotton wool spots, which could be a sign of diabetic retinopathy.
Okay.
So this concludes my eye assessment. I'm going to carry on now assessing your nose. Okay?
Thank you.
So, an inspection point of view, I can see that your nose doesn't have any signs of trauma. The nose bridge looks intact and is symmetrical. I cannot see any obvious discharge or bleeding like in epistaxis. And do you have any problem or any allergies?
No.
Fantastic. So I would like to have a look on your nose, but before you do that, can you block your nares and blow? And if you look patent?
Yeah.
Yeah? Indy, we're going to have a look on your nose now.
Okay.
Can you bring your chin up? I'm going to have point a light inside your nares. I can see the sinuses and there are no polyps, there is no discharge, the tissue are nice and pink, there is no signs of redness, inflammation or bleeding. Carrying on the assessment of the nose, we assess the patency and we inspected the inside, so I'm going to have a look now if your cranial number 1, the olfactory, is intact. So I would like you to close one part of your nose and tell me what can you smell.
Lemon.
Lemon, that's correct. And close the other one. You can smell here.
Oh, that smells like Vicks. A eucalyptus.
Good, fantastic, that's correct. Fantastic, so your nose is intact. We're going to carry on now on the ears. On the general inspection of the ear, I can see there is no obvious discharge, no signs, there are no piercing, there are no signs of erythema or lesions or trauma. So I'm going to carry on to do some palpation in the. Can you let me know if it's painful when I press your tragus? No, this could be, if it was painful, it could be a sign of otitis externa. I'm pressing your mastoid process here. Is it painful?
No.
No, this could be a sign of mastoiditis if it was present. I'm checking your pinna, your lobule, antitragus. Is any painful when I move? No, fantastic. Well, I have to pull it later on when I have a look inside your ear. Is that okay?
That's fine.
Okay. So I'm going to take my equipment and place a new speculum on top. Try to stay still, but if you experience pain, let me know and I'll stop. Okay?
Okay, nurse.
I'm going to pull back and upwards and have a look. And I can see intact ear canal, some wax and some hair, which is normal. The ear canal skin looks pink, not particularly red or inflamed. The tympanic membrane is a pale grey, and I can see the cone of light and the handle of malleus. So all intact.
Great.
I'm carrying on now doing some hearing assessment, okay?
Sure.
I would like you to occlude one of your ears, and I'm going to whisper something in the other one.
Okay.
Can you repeat what I say? 1, 2, 3.
1, 2, 3.
Fantastic. That's intact. Can you occlude the other one?
Blue moon.
Fantastic. So your hearing looks okay, and this is the cranial number 8, the vestibulocochlear or auditory nerve.
Okay.
So if there was some problem, I will carry on to do further 2 tests. One is called the Weber's, and the other is the Rinnis. I'm going to use a tuning fork. Indy, I'm going to now assess the Weber's test.
Okay.
Okay, just I'm going to activate the tuning fork and
Yeah.
position it on your head. Can you tell me if you can feel the vibration?
Yes, I can.
Is it equal?
Equal.
Side to side, fantastic. That's all normal. If it was stronger on one side, it would be a positive finding.
Okay.
I'm going to check the Rinnis test.
Sure.
Position your mastoid process. Can you feel the vibration?
I can, yeah.
Can you tell me when it stops?
It stopped.
Fantastic. Can you hear anything?
Yes.
Fantastic. So you can hear the sound, and the air conduction is better than the bone conduction, so it's normal finding.
Okay.
Now I'm going to assess the mouth. In terms of general inspection, I can see there are nice and pink lips. There are no particular crackle, any signs of dehydration or cyanosis or pallor. Having a look on your mouth, can I ask you to open your mouth? And I can see good dentation. The hard and soft palate are pink. Can you stick your tongue out for us? The tongue is nice and pink. There is no geographic tongue or a beefy tongue. It can be due to vitamin deficiencies.
Yeah.
Can you bring your tongue up to your palate? You can check the salivary glands. If there is any swelling or stones, I can check the gingivas as well for any redness and gingivitis. Everything looks good.
Okay, thank you.
I may also assess with some gloves the parotid glands and the salivary glands if I wanted to palpate, but it's not the case for this assessment. So I'm going to carry on now to assess some cranial nerves. I would like to assess the glossopharyngeal, which usually is by doing the gag reflex, similar to a COVID swab, but I'm not going to do it for this time because it can be a bit uncomfortable. But that would be the cranial number 9, the glossopharyngeal. So I'll carry on assessing the number 9, assessing the number 10. So I would like to ask you to open your mouth and say and I can see that uvula is moving upwards and is in midline position, which is normal. If it was deviated, it could be due to tonsillitis or a stroke. And do you have any problem in swallowing? No. So I suggest that the fact that you can feel the saliva and swallow, the glossopharyngeal sensory component is working, and the vagus as well, number 10, is working. Finally, I would like to check your tongue movements. I would like you to bring your tongue out. Can you bring it now side to side? Fantastic. Can you bring it inside the cheeks as well, against my hand and against here? So there's good tone and strength for your tongue, and there are good range of movements, which suggest the hypoglossal cranial number 12 is intact. Finally, I will assess your accessory muscle by assessing the accessory nerve, number 11. Can you shrug your shoulder for me? Can you move your head left? Can you move your head right? Come back midline. Can you move your head left? Can you move your head right? Can you shrug your shoulder? And there is a good strength with resistance movements, 5 out of 5, so this is all intact. Let's complete the HENT assessment. Okay? For the next part of the assessment, I would like to sit on the bed for me. Is it okay? Indy, the next assessment will include assessing your neck by assessing the lymphatic system and the thyroid. Okay?
Yeah.
On the general inspection, I can see that there is no obvious swelling on the neck, no obvious lumps. There is no any erythema or any signs of lesion, wounds, or trauma. Okay? There is no obvious goiter on the base of the neck, which could be suggesting of a hypothyroidism. Okay?
Okay.
So I would like you to have a sip of water and swallow. Hold it in your mouth and swallow. And I could see the isthmus rising, which is normal. Fantastic. Hold the water here. I'm going to come on the back. From the chin, I'm going to look for the thyroid cartilage, going down to the cricoid ligament and reach the isthmus. Can you hold again some water in your mouth? And can you swallow? And I could feel the isthmus rising. I'm going to try to palpate now the thyroid gland. And it feels soft. Is there any tenderness?
No.
So there's not particularly large, and there are not any positive findings. Fantastic. So the next part is assessing the lymphatic system. As I mentioned, there is no obvious swelling or lumps on the neck, so I'm going to carry on palpation, and then let me know if you experience any tenderness.
I will do.
So try to have a relaxed neck in a neutral position, palpating the submental, under your chin, submandibular, tonsillar, pre-auricular, post-auricular, the occipital, superficial cervical, deep anterior cervical, posterior cervical, and supraclavicular. Okay? Any tenderness?
No.
If there was tenderness and I felt a soft lymph nodes, it could be a sign of infection. If it was hard and not tender, it could be signs of malignancy. Particularly if I felt a node which was hard on the left supraclavicular, it could be signs of a Virchow node, which is associated with GI malignancy.
Okay.
Okay? But they were all normal.
Yeah.
If I was concerned, I would also assess the axillary node, breast, and femoral to rule out any lymphadenopathy.
Okay.
Okay. Indy, the next part of the assessment will be assessing your respiratory system. I would like to do a general inspection and then have a look on your thorax. Is it okay with you if you remove your shirt?
Of course.
Yeah. Fantastic. So, as a general inspection, I'm seeing that you are quite relaxed. You're speaking in full sentences. There is no obvious nasal flaring. You're not using your accessory muscle to breathe. Your respiratory rate is normal. your IE ratio, inspiratory-expiratory ratio is 1 to 2. I can have a look on your AP diameter, and the anterior-posterior diameter is normal. If it was enlarged, the shape of a barrel chest could be associated with COPD.
Okay.
Indy, I'm going to have a look on your hands now.
Okay.
I would like to see if there is any signs of nicotine staining, which could be a sign the patient is a smoker and risk factor for COPD. I will rule out if there is any clubbing. Can you make this gesture? And there should be a window in between the nail, which suggests that there is no clubbing. If there was, it could be a sign of chronic disease. That's good.
Okay.
Can you bring your hands like this? And I can check if there is any tremor. Tremor can be due to the use of beta agonists like salbutamol, but you're not asthmatic and you're not using a nebulizer, so everything looks good. Can you bring your wrist up like this? And there is no obvious flap. Flap could be associated with CO2 retention. Very good. I'm going to carry on now, and I'm going to have access on your back. So just let me know if you experience any tenderness.
Sure.
I'm just going to walk behind you. On the posterior chest, I can see there is normal shape and symmetry of your thorax. I can see that there is no obvious signs of surgery, trauma, or drain insertion. There is no obvious swelling. So I'll carry on now to do some palpation in the. Just let me know if you experience any tenderness, okay?
Okay, nice.
I'm palpating to feel structure like a scapula or ribs, and I want to look if there is any tenderness. Any tenderness?
No.
I cannot feel any crackling as well, which could be associated with emphysema. And pleuritis could cause tenderness. Fantastic. So Indy, now I would like you to hug yourself, bringing your hands towards your shoulder and lean slightly forward for me. Fantastic. I'll carry on doing some fremitus. So when you feel my hands on your back, can you say 99 for me?
Okay. 99. 99. 99. 99.
And I can feel gentle vibration. If the vibration were increased, it could be signs of consolidation pneumonia. If it were decreased, it could be signs of a pneumothorax, for instance. I'm going to check your chest expansion. Can you take a deep breath in and out? And I can see an equal expansion with my fingers. Can you do it again? And out. So the equal chest expansion, which is normal. I'm going to carry on now to do some percussion. So keep leaning forward in this position. There was a good resonance sounds on the 5-pair and 2 lateral position. If there was hyperresonance, it could be a sign of pneumothorax, and hyporesonance or dullness due to consolidation pneumonia. So I'll carry on now to do some auscultation. It may be feel a little bit cold, the stethoscope. Just breathe normally. Take nice deep breath in. Okay? I could hear a normal vesicular breath sound. If I heard crackles, this could be associated with pulmonary edema or pneumonia. If I heard wheeze, this could be associated with bronchoconstriction and asthma. So everything was intact. If I was concerned, I may do a special test. If I heard crackles on the basis, I may want to do bronchophony. So Indy, when you feel the stethoscope on your back, can you please say 99?
99. 99. 99. 99.
Fantastic. For the bronchophony test, if I heard the 99 muffle, it's normal. If it was a 99 loud and clear, it could be associated with consolidation pneumonia. Similarly, I'm going to check now the egophony. Can you say E when you feel the stethoscope on your back? Okay?
Yeah. E. 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 E.
I could hear the E sounds, which is normal. If the E changed to A, the egophony suggests there's a positive finding associated with consolidation pneumonia. Fantastic. So this completes my posterior aspects of the assessments. I'm going to carry on now on the arterial. Having a look on your neck, I want to make sure that your trachea is midline. I palpate your neck. I can feel it's falling just on the sternal notch, which is midline. If it was deviated, it could be signs of a pneumothorax. I won't repeat the assessments of the anterior, as it's exactly the same on the back, but I'd like to show that the fremitus position, can you say 99?
99. 99.
And 99.
99.
And in terms of auscultation, I'll do an auscultation on the front. Starting from the supraclavicular point, take nice deep breath in. Okay, and the findings are consistent with your posterior aspect, and there were no vesicular breath sound. Fantastic. I'm going to carry on now on the cardiovascular assessment. Okay, Indy, the next part of this assessment, it will assess your cardiovascular system. So I would like you to have a general inspection, and I can see that you have no manual flush in the face. It will be associated with mitral valve stenosis, and we rule out there was no xanthal asthma earlier on in the congenital that was pinky. So I'm going to now focus on your neck. Okay. I cannot see any obvious jugular vein distension, JVD, which could be due to right side heart failure. So I would like you to turn your heads towards your left now. I'm going to have a look at your JVP. Using tangential light, I try to look for a flickering. Once identify the flickering, I'm gonna measure the maximum point of your jugular venous pressure by positioning the ruler on the sternal angle and measuring the maximum point, which would be roughly about 3 to 4 centimeters, which is normal. You can come back to the midline position, Indy. I would like to feel the carotid pulse now.
Okay.
I'm going to feel one at a time. It's nice and brisk, there is good upstroke, and it feels regular. Fantastic. I'm going to have an auscultation now. using the bell, I would like to rule out if there are any bruit sounds. And I cannot hear any bruit, which could be associated with a carotid stenosis. Palpating the precordium now. I'm going to try to feel for any trills or lift. Trills could be due to turbulent flow or defect valves. Reaching the apex of the heart and trying to feel and pinpoint the point of maximum impulse. If I struggle, I can ask you, Indy, to little bit roll on your left hand side, just a little bit. Fantastic, would be enough. And I feel it's about 2 to 2.5 centimeters, the point of maximum impulse. Fantastic, you can come back. Now I'm going to auscultate your heart. Using the diaphragm, I'll start with second intercostal space along the sternal line for the aortic valve. Second intercostal space on the left hand side for the pulmonic valve. Fourth intercostal space for the tricuspid. And fifth intercostal space for the mitral valve. I can hear the S1 and S2 sounds, which are normal. I cannot hear any extra heart sound. I'm going to use the bell now to feel any possible S3 and S4 in the mitral position. And I'm going to check the same position earlier on as well to rule out any possible murmur or heart defect. And everything sounds normal there. I cannot hear any extra sound. I already assessed your posterior lungs. If there was lung pulmonary edema in the lung, this may be associated with heart failure, so I want to rule it out. Okay. And I would like also to assess if there is any sacral edema on the back or on the legs. So in terms of peripheral vascular, I would like to assess your pulses. Okay, I'm going to check both symmetrically, see if there is symmetry. And asymmetry in the pulses could be associated with aortic dissection. There is symmetrical, they are regular, and there is a good upbeat and good upstroke. So I'm going now to assess your brachial pulse. Then down on the leg, we're going to check your popliteal. Can I ask you to bend your knees slightly? And a good popliteal pulse. On the foot, I'm going to assess the dorsalis pedis and the posterior tibialis. And these are all intact and regular and all normal. Fantastic. So having a look on your legs now, I can see they have a symmetrical shape. There is no particular swelling, lesions, signs of erythema or rashes. I cannot see any varicose eczema or varicose veins, and I cannot see any signs of cellulitis like redness and swollen. Are they tender? Do you have any problem walking? No. Fantastic. So I'm going to touch your legs, it's okay? Sure. And they feel normal temperature, they're not particularly cold. Is there any tenderness as I palpate? Fantastic. I'm going to press now down on the ankle to rule out if there is any pitting edema. And I cannot see any pitting edema, again, could be associated with right side heart failure. Have a quick look as well on your hands. And I cannot see any splinter hemorrhages on your nail, which could be associated with infective endocarditis. I'm going to check your capillary fill. Pressing 5 seconds at heart level, and I can see the nail pigmentation come back within 2 to 3 seconds, which is normal. Your temperature of the hands as well are warm. There's no cold, which could be due to vasoconstriction. I'll check now your Allen test. So I would like you to I'm going to press your radial and ulnar artery, and I want to see your palm going white. So I can ask you to clench your hands, make a fist a couple of times. Okay, keep your hands open now. This is quite pale. I'm going to release the radial artery, and I can see now hyperemia on your hands within 5 seconds, which is normal. So the radial artery is working. I'm going to repeat this test now. Can you clench your hands again a couple of times? And we wait, it becomes pale. Now I'm going to release the ulnar artery, and I can see the ulnar artery is also working, giving a good color in within 5 seconds. It means that both your arterial and ulnar artery are working. This is called the Allen test, the modified Allen test, which is intact. And I would assess both hands if needed. So these are all intact and normal. The next part of these assessments include assessing your abdomen. Okay? So as a general inspection, I can see that you don't look particularly in pain. Do you need to empty your bladder before this assessment? Fantastic. Do you have any problem with your stomach?
No.
Good. So as a general inspection, I'm looking at your face. On your mouth, I cannot see any angular cheilitis, which could be due to anorexia and vitamin deficiencies. I already inspected your mouth in NGNT and your eyes, so I was quite happy. On your hands, I may look for any palmar erythema, which I could not see, any duplicate contractures. On the nails, I may look for koilonychia, spoon nailing, or leukonychia, white spots, which could be due to vitamin deficiencies. I already assessed that you had no flap, which could be due to liver disease, or tremor, which could be due to alcohol withdrawal. I'm going to focus then on your abdomen, and I can see obvious pulsatile masses. I can use a tangential light. I can ask you to give a cough as well. And I cannot see any bulging on any hernia. I can see the pulsation of your aorta, as I mentioned, which is normal. I'm going to carry on now to doing some auscultation. So your abdomen is not distended, and I cannot see any spider nevi, any striae. I cannot see any gynecomastia, which could be due to high estrogen levels. So auscultating, I'm going to start auscultating your arteries using the bell. This is the aorta, renal arteries, iliac arteries, and femoral arteries. And I cannot feel any bruise, which could be due to a narrowing of the arteries. So I'm going to carry on now auscultating your abdomen. Try to stay relaxed. Let me know if you experience any tenderness. It may a little bit be cold, the stethoscope. I'm going to apply 5-15 seconds. I'm looking for gargling sound. I could hear in the 4-quadrant normal gargling sound, which associated with good bowel motility. If I heard hypertinkling, it could be due to diarrhea or IBS. If I heard quiet, it could be due to maybe a bowel obstruction. So I'm going to now do some percussion of your abdomen, Indy, okay?
Yeah.
This sounds nice and tympanic. If it was dull, it could be due to a mass, like a malignancy, or stools, compactation, or bowel obstruction. I'm going to carry on now measuring your liver.
Okay.
So what we'd like you to do is take a nice deep breath in and hold. Okay, can you bring your hands and point this for me and breathe normally? Now I would like you to take a nice deep breath in again and hold.
Okay.
Okay, I'm going to measure this distance We are roughly about 7 to 8 centimeter, which is normal because the normal range of liver span is between 6 and 12, suggesting it's not enlarged. I'm now going to assess the spleen, doing some percussion on the 9th intercostal space, and I'm going to do, can you try to breathe normally in and out? And during the breathing in and out, stay tympanic. If it was becoming dull, it could be signs of this splenomegaly and is an enlargement of the spleen. Fantastic. I'm going to carry on now to do some general palpation. Let me know if you experience any tenderness. On soft palpation, your abdomen presents soft and there is no tenderness, and I couldn't feel any mass. So I'm going to proceed on deep palpation now. Any tenderness?
No.
So I couldn't feel any mass or there was any resistance, and it was not particularly tender. So I'm going to carry on try to palpate the liver. Can you take a nice deep breath in and breathe out? And I cannot feel the liver, which suggests it's not enlarged. I'm going to now assess the spleen. Breathe in, breathe out, and I cannot feel any spleen as well, so it means there's no enlarged. I'm going to try to palpate the kidney now. Try to cupping technique. And the kidney are not palpable, suggesting that they're not enlarged, there's no problem. I'm going to check both. And everything looks intact. I may check as well femoral lymph node, as I mentioned earlier on. We would consider doing a PR, a PV for women, and a testicular examination, but it's not part of this assessment. Finally, as a special test, if you had tenderness in the abdomen, I could do the Rovin signs for rebound tenderness. So I'm going to try to press quite hard and release. Is there any tenderness where I release the hand? If there was, there could be signs of rebound tenderness presence, which could be suggesting of peritonitis. Fantastic. So this concludes my abdominal assessment. So, Hindi, how are you doing so far? All good?
I'm fine, nurse. Thank you.
So the next assessment is involving the musculoskeletal system. Do you have any problem dressing up yourself?
No.
Do you have any problem walking up the stairs?
No.
And do you have any ache or tenderness?
No.
No. Fantastic. Good. Very good. So I'm going to ask you to sit on the edge of the bed.
Sure.
And I'm going to assess your arm, legs, spine. Okay? So starting with your arms, and a general inspection, I can see that the shoulder are symmetrical. There is no asymmetry, could be due to a dislocation. I cannot see any obvious fracture or trauma, lesion, wounds, erythema, or rashes. So I can carry on to do some palpation, if that's okay with you?
That's fine.
Yeah? I'm going to start palpating the shoulder and AC joint. Tell me if there is any tenderness as I palpate through.
No.
As the deltoid and the triceps, I'm palpating the humerus, the biceps and tendons, and getting to the elbow. I can feel the ulnar and the radius. I'm going to palpate down the radial and the ulnar bone, coming to the carpal bone, metacarpal. Do some squeeze here. Is it painful?
No.
Metacarpal squeeze is negative. Checking the phalanges as well, proximal and distal, proximal, medial and distal phalanges on the other fingers. Any tenderness?
No.
So this all looks normal. Fantastic. So I'm going to check now some movements.
Okay.
Can you do this for me? Fantastic. This shows there is a good abduction of the shoulder and good elbow flexion and extension. On the hands, I would like you to spread your fingers like this. The finger abduction. Can you do this? Thumb position. Can you squeeze my finger, grabbing it like this, a hand grip on this one. It's a good grip and good strength. You can release. And can you do this with earlier on as a wrist extension? So everything looks normal.
Yeah.
So I'm going to do all this movement now for you. Okay, so try to stay relaxed. I'm going to focus on this arm here.
Yeah.
Any pain or tenderness?
Nope.
Fantastic. Come back down. I'm going to focus now on the elbow. Flexing. Can you feel any crepitus on the joint? Or looks good. I'm going to check on your wrist. The good extension and fingers. All looks good. Fantastic. So I'm going to check now against resistance. Okay? Can you bring your arm up on the side? Good. Come back. Can you bend your arm? Can you flex your arm? Good. Can you try to extend it now? Good. With good strength. Can you try to touch your thumb and your finger like this?
Okay.
Good. Can you try to spread your fingers? Can you try to flex your wrist? Yeah? Good. Fantastic. So the good resistance, good strength, and was assessed in the passive movement. There was no resistance, so that means there is a good tone. It wasn't particularly flaccid, and there was no lack of power, which could be due to stroke. So I'm going to now focus on the legs. Okay. I would like you to bring you back on the bed.
Okay.
Having a look on your legs, I cannot see any obvious signs of hip replacement or surgery. The knee doesn't look having any scarrings or any particular erythema, lesions, or bulging or swelling. There is good hair distribution. It looks like good color. They are not particularly pale, suggesting good vascularization. I'm going to carry on now to do some palpation of the leg. I'm going to try to feel for the iliac crest and the hip. The head of femur, palpating the quadriceps, try to reach the femur for rolling out any tenderness. I can feel the patella, yes, with some movements, which is normal. There is no particular swelling or bulging. I can do a bulge test and see if there is any fluids coming to the knee, which I cannot see any, which is good. I'm going down to the tibia. There is not any deformity or pain. I can feel the calf. It's not particularly tender or hard. And then I can check the toes, the dorsal. I can do metatarsal squeeze. Is that painful?
No.
No? Good. So everything looks intact and normal. I'm going to now assess some movements. Sure. Okay? So I would like you to try to bring your knee towards your chest. Fantastic. You can bring it back. So there is good hip flexion. Can you bring your knee up again? Can you try to move your feet outwards? This is knee internal rotation, which is normal. Fantastic. Bring it back. Can I ask you to slide your foot towards your body? Fantastic. So there is good knee flexion. And bring it back. Good knee extension. Can I ask you to point your toes like a ballerina? Can you bring your toes now towards you? That's good. So good dorsiflexion and plantar flexion. So I'm going to now do these movements for you as a passive. I want to assess the tone. So I'm going to bring your knee up. Move it for internal rotation. It looks good. I'm going to try to bend your knee now. Can you feel any crepitus in the knee? There is good range of movements. And you can try to bend your ankle, and all looks good. Let's try some resistance. So try to bring your knee towards your chest. In good strength. Bring it back. Try to bend now your knees, sliding the foot, and bring it down. Try to push against my hand. That's good. Can you try to push against my hand here and here? Good. So very good strength. So everything seems intact. So Indy, for the next part, we're going to assess your spine. Okay. If that's okay with you, I would like to ask you to sit at the edge of the bed on your left and then stand up.
Sure.
Okay? Fantastic. In the general inspection, I can see there is no obvious deformity. There is any signs of scoliosis, kyphosis, or lordosis. Can I ask you to remove your shirt?
Of course.
So, in the inspection point of view, I can see there is no obvious scoliosis, kyphosis, or lordosis on the spine. There is no asymmetry, and I can see there is no obvious scars or traumas or lesions or rashes. So I'm going to carry on now by palpating your spine, if that's okay?
Yeah.
I'm starting for the cervical bones, going down to the thoracic. Any tenderness?
No.
The lumbars. And if worried, I would also assess the sacral, but we're going to stop here. I'm going to ask you now to try to bend over. You don't have to reach your toes, but do what you feel comfortable, okay? You can see there is a good spine flexion. Can you come back up? There's good range of motion of the spine. There was no particular crepitus and there wasn't any tenderness.
No.
Fantastic. So everything looks good, okay? Can you face me now? So I would like to check other movements now.
Sure.
I would like you to slide your hands down your legs in this way. And on the other side. So a good side-to-side flexion. Can I ask you to try to move your spine left and right like a rotation, but try to hold your hip still, okay? So you're moving mainly your upper body, yeah? Okay, so the good rotation, fantastic. Having a look on your neck, we already assessed the range of movements earlier on the cranial nerve number 11. So I would like to see some active movement. Can you bring your heads up and down? Come back normal. Can you bring your ear towards your left? Come back normal, towards your right, normal. And then we've done already left to right earlier on. So everything looks normal, there's a good range of motion. Indy, for the guys assessment, we're going to now assess your gait. I would like you to walk in front of you. And I can see there is a good stance and 6 to 40, which is normal. Can you come back, turns towards me? Now walking towards the wall, I would like you to walk tandem, so heel to toes, okay? Okay, good.
Yeah.
So there was good coordination and good balance, which is part of a cerebral assessment, which is the next assessment we're going to do, the neuro assessment. So I'll ask you to put back your shirt and have a seat. The next assessment is the neurological assessment. I'm going to ask you some questions. Even if they sound silly, try to answer on your best of your capacity, okay? How are you today?
Okay.
Good, fantastic. Can you tell me where you are?
I'm in the hospital.
Fantastic. And can you tell me who was my role?
You're the nurse.
Fantastic. Can you tell me roughly what time of the day it is? Is it morning, evening, afternoon?
Afternoon.
Fantastic. So it's all correct. You look you're orientated in time, space, and person. I would like you to repeat this address for me.
Okay.
It is 42 West Street, London. Okay?
Okay.
Repeat it all together.
42 West Street, London.
Fantastic. I'm going to ask you this address later on, so try to keep it in mind, okay? Indy, I'm now going to assess your long-term memory. So can you tell me when the last time you've been on holiday abroad?
I went to Turkey a few weeks ago.
Fantastic. And you went to do what there?
Oh, just relax and drink.
Fantastic. And I confirm that is true because I saw some picture on your phone you were showing me earlier on, so I can confirm that's correct.
Yeah.
Fantastic. I would like you to count backwards from 10 to 0.
Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Fantastic. This shows that you have a good concentration. Can you do a simple calculation for me? Can you do 4 plus 4?
8.
Minus 3.
5.
That's correct. So a good calculation and cognition. And can you tell me how did you get in today at work?
I drove.
Okay. Did you find a lot of people, a lot of traffic?
Not as much as usual because of the summer holidays.
Fantastic. If you were waking up and going to the car and the car wouldn't turn on, how would you get to work?
Train.
Train. Okay, so that sounds reasonable. And if it was raining, would you change anything in your commute?
No.
No, fantastic. Okay, so all the questions sounds reasonable and there is a good reasoning. Could you tell me what a chair and a table has got in common?
Legs.
They both have legs. That's correct. So good abstract thinking. And one last thing, Indy.
Yeah.
Can you draw on my hand a square? And then can you draw it a circle inside the square? Fantastic. So this shows that you've got good construction. And finally, can you repeat that address I asked you earlier on?
42 West Street, London.
Fantastic. So that's all normal. So I'm going to carry on now assessing your sensory component of your neuro system. So I'm going to do now some soft and sharp as we did earlier on. Just to remind you, this was sharp and this was soft. Okay? If you close your eyes, can you tell me when you feel sharp and soft?
Sharp. 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 Soft. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft.
So this all looks normal. These are your dermatones. Suggest there was a block on your spinal cord. You wouldn't feel anything, but actually have a good sensation of soft and sharp.
Thank you.
So I'm going to carry on now, check your vibrational sense. Can you bring your hands like this? Can you close your eyes? And can you tell me if you can feel a vibration?
Yes.
Yeah?
Yes. Yes. Yes.
And I would check
Yes.
also your toes in the same way. Okay? If you had numbness on the hands, could be due to a vascular problem. If you have numbness on the feet, could be due to a diabetic neuropathy. Okay? So that's good. I'm going now to assess stereognosis. So can you offer me your hands and close your eyes? I'm going to put an object in it. Can you tell me what object it is?
Battery?
It's a battery. Yeah? Correct. Well done. Finally, can you stand up?
Of course.
When doing a Romberg, so I would like you to close your eyes. I'm going to wait for 20 seconds roughly, making sure you don't have any swing. You can be able to hold your balance. That's good. Open your eyes and sit back again. That's good. And the last test to check proprioception.
Yeah.
I'm going to take your hands and show you. This thumb is in mid position. This is up. This is down.
Okay.
Close your eyes and tell me what is your thumb.
Up. Down. Up. Mid. Up. Mid. Down.
Okay, so it all looks normal. You're able to recognize the position of your thumb without looking at it. So we're going to carry on now assessing your coordination. I already checked your gait and it was having a good balance. I would like to check the rapid alternative movements. Can you do this as quick as you can? Very good coordination. I may ask you to do as well a foot tap, but for this assessment the hands is enough. So I'm going to carry on now checking your finger to nose.
Okay.
So I would like to touch your nose. Can you touch your nose and then touch this finger? Okay? As quick as you can. Come back.
Okay.
And in and out. And try to... Good. That's a very good coordination. And last test is standing up. Bring your hands with the palm upwards and close your eyes. I'm going to tap on your hands. I want you to keep the hands in the same position, okay? Okay, so there is no drift. If there was a hands twisting and pronating, it could be due to a motor neuron disease. Okay, so you can sit back now. And finally, we're going to assess your reflexes, okay? I'm going to check your supinator and brachioradialis. Try to stay relaxed. And I could see the thumb moving. I'm going to check now the biceps. Try to stay relaxed. I'm going to try to look if the biceps is contracting, so there was a good reflex there. I'll check now the tricep. There was some recruitment and it looks good. I'm going to check now the patella. And there was some recruitment of the leg, and I could see the quadriceps contracting, which is normal. I'm going to assess now the plantar and the Achilles. And you can see the foot moving. I need to do it again. So for the Achilles, it's all good and normal. Can you come back on the bed? I'm going to check your plantar reflex finally. I'm going to check now the plantar reflex. And this one. And you can see the toes curling, which is normal. If they were spreading and fanning out, it would be a positive Babinski sign. So Indy,
Yes.
let's conclude the top total assessment. I couldn't find any positive finding, which suggests everything is normal. Do you have any question?
No, I don't have any questions, but thank you.
Fantastic. Let's conclude the assessment.